Hello everyone. Today, we're diving into the world of a medication called Westcort. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Westcort, scientifically known as hydrocortisone valerate, is an ointment used for topical dermatologic applications. It belongs to the class of topical steroids and is primarily used as an anti-inflammatory and antipyretic agent. Westcort ointment contains hydrocortisone valerate, a synthetic corticosteroid. Each gram of Westcort ointment contains 2 mg of hydrocortisone valerate. The ointment is formulated with various inactive ingredients including carbomer 934, dried sodium phosphate, mineral oil, propylene glycol, and others. Clinical pharmacology: hydrocortisone valerate, like other topical corticosteroids, possesses anti-inflammatory, antipyretic, and vasoconstrictive properties. The exact mechanism of its anti-inflammatory activity remains unclear. However, corticosteroids are believed to act by inducing proteins that inhibit the biosynthesis of inflammatory mediators. Indications and usage: Westcort ointment is indicated for the relief of inflammatory and pruritic manifestations of corticosteroid-responsive dermatosis in adult patients. Contraindications: the ointment is contraindicated for patients with a known hypersensitivity to any of its components. Precautions: systemic absorption of topical corticosteroids can lead to reversible suppression of the hypothalamic pituitary adrenal (HPA) axis. This can result in conditions like Cushing's syndrome and glucocorticosteroid insufficiency after discontinuation. It's essential to monitor patients for these conditions, especially if the ointment is applied over large surface areas or under occlusive dressings. Pediatric patients may be at a higher risk due to their larger skin surface area to body mass ratios. Side effects: in clinical trials, some patients experienced side effects like worsening of the condition, itching, irritation, and redness. Other potential side effects associated with topical corticosteroids include burning, dryness, folliculitis, acneiform eruptions, hypopigmentation, allergic contact dermatitis, skin atrophy, and more. Dosage and administration: Westcort ointment should be applied as a thin film to the affected area 2 or 3 times daily, depending on the condition's severity. If no improvement is observed within 2 weeks, a re-evaluation of the diagnosis might be necessary. The ointment should not be used with occlusive dressings unless directed by a physician. Storage and handling: the ointment should be stored between 59 to 78 degrees Fahrenheit, 15 to 26 degrees Celsius. Closing: that concludes our overview of Westcort. As always, this information is for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.